I'm Peggy Peck, MedPage Today. I'm at TCT 2008 in Washington with Dr. Alexandra Lansky, and we're discussing some interesting findings from a study that looks at stress and what effect stressors, or at least a scenario of stressors, might have on actually getting to a diagnosis of coronary artery disease in men and women. So, Dr. Lansky, could you describe just briefly this study?
So the point of the study is essentially looking at the impact of adding a stressor to the history of coronary disease with a fairly typical scenario of chest pain. And the essential findings here is when you add a stressor to a patient's history, to a male patient's history, it actually increases the likelihood of reaching the diagnosis of coronary disease, whereas in female patients, it actually reduces the likelihood of reaching that diagnosis.
So now this study was conducted in primary care physicians. So what then is the clinical implication for primary care physicians, who after all are often the first people that either women or men go to with their symptoms?
Well, absolutely. They're the front line. And I think the message is that you have to take the history as it stands and not be influenced by whether or not these patients are affected by outside stresses. I think that's the important finding.
Thank you very much.
Thank you.
At TCT in Washington, I'm Peggy Peck, MedPage Today.